you for joining us for the Birth Bootcamp podcast. I am Cheryl Ameling, the certification coordinator.
I am Liana Wolf, the administrator.
And today we have Dr. Toya with us, and we are going to talk about just kind of like postpartum care and addressing the gaps in postpartum, for women and babies and families, and how that looks and how we can do better. So, thank you so much for being here, Dr. Toya.
Thank you so much for having me. I am very excited to be here.
Thank you. Yeah, we're so excited to have you. This is such an important conversation to have and to keep having. So let's just start out. Tell us a little bit about yourself. Tell us about your family, where you're from, all that.
Yeah, so I am Latoya Lusa Sampson, or Dr. Toya. I'm originally from Trinidad and Tobago in the Caribbean, and I went to undergrad and medical school at Howard University. I did my OBGYN training in Pennsylvania Hospital in Philadelphia, and then I've lived in California ever since, in Northern California, and I've been practicing here for the last 8 years. And I have a husband and 2 children. My daughter is 9 months yesterday. So I am postpartum myself. And I recently launched my virtual GYN practice, specifically focusing on supporting women in the postpartum period, particularly with mental health support. Mm-hmm. So that is me in a nutshell.
I love it. I love it. Well, thank you so much. I like I said, like this is such an under-supported time in a woman's life. And so I love that you're really focusing on that, especially being postpartum. So like right now you're experiencing it firsthand, and kind of seeing the gaps and seeing where the system needs to do better.
Yes, definitely. Lots and lots of gaps.
Mm-hmm, mm-hmm.
Yeah.
Well, with that system, what is the current postpartum climate in the US from your perspective?
Yeah, so it's lacking. That is that's the only way to say it. Let's cut right to it. So currently, even though there is a push from the top being ACOG, the American College of Obstetricians and Gynecologists, to improve postpartum care, it takes a while for those changes to trickle down to us, right? To me and my colleagues. So they are aware of the gaps, but on the base level where the actual care is being given and received, patients are being seen at 6 weeks after they have their baby for a very short period of time, and then that's it. And those are the people that actually show up, right? So there's a very high percentage, right, of moms that just never go for a variety of reasons. And knowing what happens when they get there, I'm not surprised. Like, why bother, right? Because some people don't even get an exam. They just get told, here's your birth control, bye. If they are brave enough to bring up their mental health concerns, they say, oh, that sucks. Okay, bye. It's just, there's a lot of work to do currently. And it's coming, like the change is coming, but we have a long way to go.
Yeah. That's so interesting, thinking about like if they even go. I never even thought about that. like if you even show up, because is it even worth my time? Nobody's looked at me since I had the baby anyway. So
right.
I guess I'm doing okay. That's
right.
Yeah, that's such a good point.
Yeah. And especially when you think of like economic disparities and whether or not people can take another day off just to be seen for 10 minutes.
Mm-hmm.
Maybe fill out a little form about your mental health, maybe, if they do it. Yeah. And like you said, Dr. Toya, being brave enough to speak up about how you're feeling.
Yeah.
There's still like areas where some people are like, well, if I tell them this is how I'm feeling, are they going to take my baby from me?
Yes.
And like, we got to get away from that somehow.
Yeah. I mean, it's definitely a time where people pretend, and I've seen it when I was in the office, and this is, even though now it's passion of mine and part of my mission. It's always been that special interest when I was in practice. Like my postpartum visits always went over because I would stay talking, doing lactation, like consulting, like all these things. And at my last job, I was fortunate enough to have support of a clinical psychologist right down the hall. Like I would be able to say, oh, you need more than me. I would leave the room, go grab her, and she would come right in. It was amazing. And then even while I was there, she left, so it wasn't as great. But in general, at that job, they took the mental health support very seriously. So I was kind of spoiled in that respect. But you see it, you're like, are you okay? And the eyes divert, or it's just like flat and this one word answer. And in that point, as somebody who has a full schedule, who has a time limit, you have to decide, am I going to notice that? Well, first of all, you have to notice it. Then am I going to acknowledge it? Do I have the time? Am I going to sit and talk about it? And I made that decision more often, like all the time I would say, but I can see in somebody who is not as supported, who's not as intuitive, like doesn't have the intuition, it can get left, right? And then the patient is there feeling just as lonely, just as unsupported, just as depressed or anxious. And then they're
so true.
Sorry. I didn't mean to, like, it's just, but that has been my experience.
Yeah. Well, and there's, I mean, like you said, like you have to notice it first.
Right.
And a lot of times we're so busy and we don't even notice people struggling. And then if you notice it, you have to do, are you going to do something? You have to make that choice. Am I going to do something? And then you have to know what to do. I feel like that, like for me specifically, I won't speak for other birth professionals, but like for me, where I am, like it's hard. I don't know where to send people. I don't know how to help people because these aren't just like readily available things, because nobody talks about it. Nobody sets women up for help after the baby, especially with mental health things. So, I mean, it's all a big mess, I guess.
Yeah. So we're talking about what it looks like now. What should it look like? What should our care be right after we've had a baby? And not just the right after, but the 6 weeks after and the 6 months after. What should that look like?
So as I said, they're trying from above. So officially, we want people to be seen within the first 3 weeks after they give birth. Especially if you've had a complication. So say you've had preeclampsia, high blood pressure of pregnancy, you really should be seen within 7 days of birth, right? Because you need blood pressure checked again. Postpartum preeclampsia is a very real, very serious thing, right? So anywhere from the first week to 3 weeks. Then at your 6-week checkup, that's when you get the comprehensive exam. You're supposed to get your comprehensive exam, assess the mental health, assess your general chronic medical problems, the baby, the lactation, the family planning, all of those things. And even if it doesn't happen exactly at 6 weeks, it should happen before the trimester is over. So before that 12-week mark, right? And then beyond that, everything kind of fizzles out in terms of official recommendation. But in my opinion, the care should continue, right? Because medically, postpartum is the first year after birth, right? And there are still changes that are happening to our bodies. There's still support that we need, especially when it comes to the mental health. And I think everybody assumes, even the person, right, that, well, it's 12 weeks, I'm supposed to be back. And however I'm feeling is because of some feeling in me or something's wrong or whatever, when you are still postpartum, right? So there's care that needs to be had. And addressing, what do you do? There are support groups. I like mom groups because it gives you the mental health support and the community to address that loneliness that comes, that isolation that comes with being postpartum sometimes. And it kind of helps us fill those gaps where, you can't get in to see a therapist. You can't get into, your doctor or anything like that. So I think providing that extended care throughout the first year is really ideal, and that's where I'm focusing. So beyond the fourth trimester, I think we need to put the focus there as well.
Yeah. I love that. So you said that you're launching this this practice. So what is this like? What does this look like for a woman, like in your care?
Yeah, so it's Amino OBGYN Consultants is the general practice. It's all virtual gynecology. So not virtual pap smears, but there are lots of things we can do virtually. And with the main focus being postpartum in a way that I feel like is kind of addresses a lot of the issues, being group visits. So the first program that I'm launching is called Beyond the Fourth Trimester. And it is a group program that lasts for 12 weeks that takes a small group of women, keeping it small because these are intimate times, and some people may not be comfortable and things like that. And really filling all of those gaps. So the reintroduction into the medical system, like what problems did you have during pregnancy that are not chronic? What do you need to see your primary care about? What specialists do you need to follow up with? And kind of directing people, because a lot of times you don't know. And a gynecologist is done with you, not to make it sound like that, but that's kind of
That's
how it is.
true. Yeah.
They're done. And you're like, well, what do I do? My blood pressure still might be high. I may now have type 2 diabetes. Like, what do I do? So addressing all of those things. And in community, in the group visits, so that we can support each other, and having women that are different stages, so you can see that there's a light at the end, right? People who have been through it can look back and give advice. They can see how far they've come. So there's a lot of healing in a group, especially with people of different stages of their journey. Then, in addition to that, having the individual sessions with me, so that if there's anything you're like, I really don't want to discuss this in a group, if there's sensitive issues, if you need medication prescribed, those kind of things can be addressed in the individual sessions. And one thing I didn't mention is I am getting my perinatal mental health certification. So
that's awesome.
Yeah, because I've always had this interest in this area, but I had the support, and now I don't. I wanted to be able to elevate the kind of care that I was able to give. And, doing the certification will help me do that. So, it's a really comprehensive, a really holistic type of care experience, throughout that first year, and it will be ongoing, right? So there'll be a private Facebook group so that even after the program is over, there's ongoing care, ongoing community for the people who participate.
That is so great. I love that so much. Just being able, so as a birth doula, I always really encourage my clients to get support, social support, whether that's a lactation group or a MOPS group or something, because even though they have me as a referral to 8 weeks after delivery, it's not the same as having somebody who's there in it with you right now. It doesn't matter that I have breastfed multiple babies, I have exclusively pumped. It doesn't matter because I'm doing it now. So I really love that you're focusing on the community aspect of that.
Yeah. It's very important, because one thing I felt in my postpartum journey is alone. And I was lucky that I had one of my very good friends who I went to medical school with. She was also on her journey. Her son is a couple months younger than my daughter. So I had my little community. I had somebody to talk to, somebody who knew exactly how I was feeling. And as she was going through the things, I was able to say, this is what I did, this is what I did. And also remind her of the things that she told me when she was helping me out, right?
Right.
She was like, remember you told me it'll be okay. Also, the community is so important. And what sparked this entire thing really was when I did a webinar. It was called Ways to Thrive Postpartum. And I was preparing for it. And I was like, I kind of like this. This is exciting to me, because I create for TikTok, like I educate online, and it's always weird talking to no one. It's a weird thing creating content, right? So the idea that I got to speak to people, and that's why I like doing podcasts, like I get to interact. I like this. And then when I actually did it, I did the presentation, and then my favorite thing was over. People just got to speak, share their stories. I had a good friend who came on who told, she shared that she started Alexa recently, antidepressant, and it really helped her. It was just like, this is good. Like, this can be a way to provide really good care this time. And the rest is history. Here we are. So community, I think, is really important.
It is. Well, and I love what you said about, like, there's so much healing that happens. Like, I think that when you have a group of women doing the same thing at the same time and sharing their experiences and sharing their feelings and being vulnerable and the safety of that, like, there's a lot of power that happens in there, and there's a lot of healing and a lot of growth that can happen, and a lot of like um like confidence building. And okay, she's encouraging me, she's been through this, I can do this with this help. Like, it changes your experience. And postpartum, like you said, is so isolating. And you have this tiny human that you have to keep alive. And while you're also, dealing with your own stuff of getting that human out of your body, like, it's a lot. And then we just say, like, okay, well, cute baby, good luck, see you later. And that's just, it's not fair. It's not fair to anybody. So, I mean, like, wow, the things that you're putting together are just incredible and going to be so life-changing for so many women. That's amazing. Thank you.
I hope so. I really hope so. And something you said kind of just, I have my soapbox that I'm going to get on.
Good.
About
we love a good soap.
We do.
About that, the isolation and the focus on the baby. Like, that's one of my things. Like, I don't know how much y'all have been seeing my content. It's like mom first, right? Because you have to be okay in order for the baby to be okay. And one of the things about the isolation of postpartum, it's so unique, is because usually you're surrounded by people, right? You're surrounded by family, but they're all there for the baby, right? You're just like this prop that's feeding, holding, and it's like you're not even there. And I really want women to normalize prioritizing themselves in this period. And it's not a selfish thing. It's essential, right? It is essential for you, for your health, and for your family. So I just wanted to say that.
Yeah. I mean, yes, spot on.
We're fully on board.
Totally. Totally. I mean, because that's the whole thing, right? Is that we're told, well, at least you have a healthy baby. And so completely, like, not taking into account anything about you or how you feel or your birth experience or anything. And then you're right. Like, we're just a pair of breasts and, and that's it. And you're right. I mean, I like the way you worded that, like everybody's there for the baby.
Yeah.
Nobody's there for the mom.
Yeah.
And she's the one that she has to be okay so that her baby will be okay.
Yeah.
Like the baby is the one that suffers ultimately. I mean, yeah, I hadn't put all that together. So, I mean, I love the way you worded it.
Yeah.
Yeah. So as childbirth educators, Cheryl and I both, and all of our instructors through Birth Boot Camp, we talk to students about the importance of lining up postpartum support and giving people jobs. So even if you can't, we know that a postpartum doula is not financially feasible for everybody, but the idea of like, okay, if you're going to come visit, you're not coming to visit to hold the baby,
right?
Unless I need you to hold baby.
Yeah.
But it needs to be you're coming to support me, and you get to see the baby as a side effect of that. What else can we do as childbirth educators and as doulas to support the families in their postpartum period, aside from highly encouraging a postpartum doula? What else can we do?
Yeah, I started laughing just because is like that was like number one in the webinar. Like get help.
Yeah.
Get help. Get a postpartum doula, get a night nurse, get somebody, get help. So it's so important. And I like what you said. It was one thing. I'm a realist, and I pride myself on practicality. I know a lot of things are not accessible to everyone. So I just put that caveat. I know people have different situations financially, and this is not to say disregard everything, put yourself in debt and do all these things. Do what you can, and also approach all these things with curiosity, right? With a determination that I am going to get help. How can I get help? Right? What boundaries can I set? Like you said, for if somebody's coming to see me and the baby, so I said me and the baby, then you have to help or you're not coming, right? So it's not just, well, maybe I will ask them, you will do this or you're not coming, right? And empowering women to do that, because some family can be intense. It can be in-laws and things like that. So I think getting the family involved during the pregnancy and going over these things and really focusing on the postpartum recovery just as much as we focus on the newborn care, so that we know that it's two separate things, and really letting the family know, this is a recovery, this is something that needs to happen, and this is how you can support this person during this time. And if you want to pay for these things, if you don't want to do it, you can do a gift certificate, you can do a voucher, you can order DoorDash and send it. You don't have to bring it yourself. You can just send it. So there are lots of things that people can do to support, and it does not have to be that you're coming out of pocket for all of these things.
Right.
Yeah. I remember my parents came to visit me after the birth of our third baby, and getting up one morning and coming downstairs and seeing my dad had just cleaned the kitchen beyond anything that, like, I don't think our kitchen had ever been that clean before. He washed the sink. Like, he had everything clean. He did not only ran the dishwasher, but he stayed up until it was finished and emptied the dishwasher.
Nice.
I remember I was, I don't know, maybe a week and a half postpartum, and like walking into the kitchen and just breaking down.
I was about to say tears.
Because it was just one thing
that
I didn't have to think about. And my husband has always been really supportive and does what he can, but he's usually supportive in terms of managing the older kids.
Yeah.
Like, he's making breakfast, he's getting them dressed, he's doing all that stuff. So for him, the added mental load of chores was too much. So for my dad to come in and just like do that was phenomenal. And so I was like, you get to hold a baby.
Yeah.
Thank
you
you.
get the
You
award.
get to hold a baby.
I love that. A man after my own heart. I love it.
Yeah.
I love that too.
Yeah.
Well, one thing, Dr. Toya, that you said that made me think that like it's kind of interesting after you have a baby, like the text that goes out or the announcement that goes out, and it always ends with mom and baby are doing well. And we think about the baby, like now the baby has to stay alive outside of the womb. But we don't really focus on the part of the mom of that postpartum recovery. Like it's two things. And
Yes.
we think about like, oh, she's doing well, period. Like I don't even know what that means. Like she
Yeah.
I don't know. And so but like focusing on that part too. Like baby's doing well. And so is mom. And so for mom to keep doing well, we have to take care of her. We have to take care of her just like we're taking care of this baby. And not forgetting that, just because we can't see, that she needs to heal, like there's not an outside wound that we're like, oh, that's a big old gash you got there, we're like, it's all interesting. So we forget that it's that she's healing from this really big thing, and she's, and her milk is coming in and she's still bleeding, and like there's a lot that happens to the body after the baby's born. And she has to be taken care of. Yeah. And I always talk in class about like setting those boundaries. Like you only get to hold the baby if you clean the kitchen really well. Like I love that. I'm going to use that in class now. So so setting up that support I think is really, really important.
Yeah. And one thing I just want to say about the mom and baby are fine. Usually, and this is a lot on us as OBGYNs as well, when they say that, they mean mom is alive, right? That she survived.
Exactly.
Right?
Yeah.
And that's like I follow Jen Hamilton on TikTok, and she says like that healthy mom, healthy baby. That's like the expectations on the floor. Like we need to do better than that.
Right.
And
raise that
acknowledging
bar,
that,
friends.
she's alive. Yay.
Right.
And the bar has to be there in the country, right? Because so many are not.
It's true. That's true.
So it's like there's so much work to do.
Yeah. How can we normalize being able to say, like you were saying, after those birth announcement posts, like mom and baby are doing well right now,
right?
But mom needs your continual support, and
send
being
food.
able to be free to say that, and not be afraid to set expectations for people to come and support. Like, please come help us and get away from this American idea of everything's fine and we're going to be fine. And well, never mind the idea of I have to go back to work in 6 weeks, so I better be fine. But I mean, that's a whole other soapbox.
I know we want.
I was like, oh, you just opened another one.
I know, but you know what I mean. It's all looked in to this needed support. So whether she gets 6 months off before she has to go back to work, or whether she only has 6 weeks, how can we normalize this expectation of friends and family and community? Like bringing that village back.
I think being loud about it, doing what we're doing right now, I think that is the only way to normalize anything, is to just keep talking about it, proceed with persistence, because it is too important. We are losing too many, like the rate of postpartum suicide is through the roof. Like it is too important for us to stop talking about it. And I know I am going to, and I feel like, I'm walking in my purpose, and I will continue, even if it has to take on a different form or shape. This is important to me. And I encourage everyone, especially for the people that are in it right now. So if you are, whoever's listening to this, if you are struggling, get the courage somewhere, take it from me, to say how you're feeling. And if you are discarded, proceed with persistence. Keep talking about it. Find somebody who will listen to you. Talk to your doctor. Like, it is too important and we need you around.
Mm-hmm.
Yeah. Oh, I love that. Thank you for saying that. Because I think that it is so scary to admit that you're struggling.
Yeah.
And to think like, will I be heard?
Yeah.
Will people think I'm a bad mom? Like, these are like, it's so hard. It's so hard. But to know that there are like you said, like people speaking up about it and saying it's okay to struggle.
Yeah.
And let's get help.
Yeah. And it doesn't make you a bad mom.
Right.
Yes.
Right.
Part of that isolation is thinking that nobody else is going through this. And that's so far from the truth. Like, and it's one of those things, nobody talks about it.
Right.
But you just don't know. There's somebody going through it. There's somebody who has gone through it and they can help you. They will hear you.
Yeah. Well, and nowadays we see social media with the girl with her cute messy bun, and she's like, I'm 4 days postpartum, and she's, and you're like, she looks like she just got out of the shower, and I'm like, I haven't showered in 6 days, and
Right.
I have like milk all over me. I haven't changed my shirt, like social media makes it look glamorous, which then makes us feel like we're failing even more.
Yes.
And we compare ourselves to a filter.
Right. And that's why I like TikTok. That's my other mini soap. It's not even a soapbox, but every time I go on Instagram, I feel bad about myself. So I don't go on there. And that's one of the things that I also went through in my webinar is being cautious about the people that are in your circle, right? So when you find this community, it can be of moms that make you feel bad about yourself. Like, so it's not just any community. You really have to curate your community because there are people who are going to make you feel bad. There are people that are going to make you feel like, oh, I'm a good mom after all, because they like hate their kids or I don't know, whatever. So you really have to be intentional about the people that you let into your space, the ones that you control, because sometimes it's family and then,
Right.
Exactly.
My kids' school, they talk a lot in their community about being a community. And one of the metaphor they use is filling up buckets. And you want to be a bucket filler for your friends. You don't want to be a bucket dipper. So you don't want to be taking from other people. You want to be pouring into them, into their bucket to make them feel better. And I'm like,
I love
adults need that too.
Yes. I love that.
Yeah.
Yeah.
I love that. That's so true. So is there anything else that you like really feel passionate about or feel like you want moms out there to know or to hear or anything?
Yeah. And we talked about a lot of the big ones. My major thing is the mental health portion. Just, tell somebody. And it's okay for you to feel however you are feeling. This phrase, I'm supposed to be okay, right? I'm supposed to know how to breastfeed. I'm supposed to be a good mom. You're not supposed to be anything, right? However you are right now is how you're supposed to be. And it's okay. And I feel like just knowing that you are not alone is really, really important. Reach out to somebody and get somebody in your circle who will listen to you, care for you, hold you. That everybody wants to feel cared for, right? The baby, your husband, like every human wants to feel cared for. Postpartum moms, we're no different.
Right. I love that.
Yeah.
Okay. Where can we find you on social media or like your group
everywhere?
Your group class that you're doing?
Yes.
Yeah. How can people access your class?
Yeah, let's start with that. That's good.
So it's more than a class. Okay. So it's a medical program. So that's a very common question, like, is it, because it seems like coaching, because so much of what we do as OBGYNs, or what we're supposed to do, is like coaching. But it is a medical program where I am caring for people. And I put it that way specifically if I need to prescribe like antidepressants or anything like that,
Okay,
that I
makes
can
sense.
do that, right? So I did that on purpose, because it would have been a lot easier for me to not do this as a medical thing. But it was that important to me. So it can be found at Dr. Toya OBGYN/telehealth. So that's DRTOYA OBGYN.com/TELE health. And I'm the same handle everywhere, is Dr. Toya OBGYN, on TikTok, Facebook, YouTube, Instagram. Everywhere. I make it really easy. So the program is called Beyond the Fourth Trimester. It is launching November 13th. It will not be the only program. It is not the only way that I plan to support mothers postpartum, but I really want to get people in this group to get into the community and just heal, feel cared for, feel like they have a community that cares for them, all under the expert guidance of a board certified OBGYN who is also postpartum, right? So that is my goal.
I love it. So what does it look like? So if I'm, so at what point does somebody jump into your medical program?
That is an excellent question. So beyond the fourth trimester. So
beyond the fourth trimester,
talking about care, just like what we've been talking about, during those 12 weeks, you need to see somebody in the office, right?
Okay, so it would be
postpartum, from 3 months to 12 months. So anyone in that time zone, and not that saying that people immediately postpartum within in the fourth trimester don't need care. I just feel like they deserve more care than anything virtual. And my program is wonderful, but it's still virtual, right? So I really believe in that period, people need to be seen in the office by their OBGYN. If there is anyone who needs like one-off support or anything like that, they're free to schedule individual consultations. But for this program being virtual, and that 12-week long kind of thing, I put it for anyone who is 3 months to 12 months postpartum. There are people past 12 months probably need it as well. So, but yeah.
Okay.
Yeah.
So is it something that like they would, like, if I'm planning on doing this, can I seek it out like prenatally and kind of like know that I'm going to like access this postpartum, or do I wait until I'm postpartum?
So I think that is an excellent point. Everyone should be planning for their postpartum during the pregnancy. And I think especially first-time moms, that's something else we need to be loud about and teach people about. Because I'll tell you a story. I was in one of my Facebook groups, and it was an OBGYN group, and she was a first-time mom, and she said, any books that you can recommend for postpartum for an OBGYN who's a first-time mom. Everything, even though we are women's health doctors, everything was about the baby. Every single recommendation. I was the only one that said, hey, do you have a doula? Do you have a night nurse? Do you, like, some of the things she had never even heard of, right? I was the only one that mentioned anything about any kind of self-care, recovery. So during pregnancy, you need to plan for your postpartum. And if you know that this is something that you're interested in, it's definitely, you can reach out to me, and we put you on our list, and we'll be able to send you tips and our newsletter to give you the information that you need so that you still feel supported during the fourth trimester and afterward. And then join the program. It's definitely something that everyone should be thinking about during the pregnancy.
Okay.
Right.
I love that.
Yeah, I feel like I gave you long answers for very short questions, but I like to talk.
No, I like the long answers.
I love all the information.
Right.
This is great.
Yes, I agree.
Yeah, thank you.
I agree. This is so great. Okay, well, any closing thoughts from anybody? I feel like you left us with so much to think about and to like chew on later.
Yeah, I was about to say, I don't know how much, well, I have a lot to say, but yeah, just spot me on social media. I put, when we mentioned about the accessibility, having a postpartum doula isn't always accessible. My program isn't going to be accessible to everyone, but because I know that having this program and serving a wider community, they're equally important. I will continue to create, right? I will continue to put content out there. So all of my messaging, all of it is out there, right? All of the support, all of the advice is out there. If you comment on one of my videos with a question or something, I'll make a video about it, right? So I want us just to normalize taking care of ourselves, prioritizing ourselves in not just in postpartum, but as men in general, right? We are it. We're number one. Everything else is secondary.
Yes. Yeah. That's so good.
Yeah.
Oh, thank you so much for spending time with us and sharing about just, your postpartum experience and kind of postpartum in general. It's so important. And I think a lot of times we prepare for birth, but we don't prepare for postpartum, and postpartum lasts way longer than birth.
Right.
Way
Sure
longer.
does.
So, so I love, let's keep talking about it. Let's normalize it. Let's get the support that women so desperately need and deserve.
Yes.
You deserve it. So, all right. Well, thank you so much for being with us. I appreciate it.
Yes. Thank you so much for having me. This has been lots of fun.
Good, thanks. Okay, well, subscribe, leave us a comment, leave us a review, all of that, and find Dr. Toya on all of the platforms, all the things. I really enjoy your content. It's really great. So
thank you.
All right, and we will talk to you guys next time. Bye.